What question do you have?
So I read everything and I use
Yeah.
AI. So I put your articles in AI with a bunch of all my stuff, my information, my labs,
So
whatever.
which AIs do you use?
I use Claude and it's linked with self-decode genetics. So there's a bridge between the two
Oh,
software.
you're using the Claude code, right? The
Yeah.
desktop version.
So it sees my genetics. So it can, what's been confusing for me lately in your most recent article, I understand the depletion. I understand starting lower. So I restarted this week lower at 0.1. But the thing is that now so much different aspect that you put out there with methylene blue, alternating days with doing 5-2 or every other day. So I had my game plan and then I saw your article and I was like, oh, wait a minute. Now what am I supposed to do?
You know what you think is right, but the general way is that general way in medicine, as you know, you're a nurse, right? And
Mhm.
as you know, it's very simple. Let's say a high blood pressure patient comes in, right? And then you know there are many medicines, but usually you start with one, and then you kind of push it right to the
Mhm.
level of like optimal, and then beyond the optimal, you can still go higher, but the chances of getting side effects is higher now. So what do? They add a second agent, and then they push. But for me, it doesn't work for everybody because some people are so sensitive to LDN, even at 10 nanograms, they say they can't take it. And like I said, recently I have had people that I have to use 10 nanograms and they're having even trouble with that. And then the next dilution will be 100 picograms. You know, that's pico is 10 to the minus 12, right? Nano is 10 to the minus 9, and micro is 10 to the minus 6. Milli is 10 to the minus 3. So if you think about milligram to picogram, oh my God, there's like 8 zeros.
Mhm.
Consistent because in the environmental medicine, we're taught that how we respond to environmental toxin response individually because of genetics differ by billion times. And billion has 9 zeros, isn't it?
Mhm.
Yeah. So I think it's normal. So I would say that do your way, but go gentle and then push it until you feel like your optimal dose. And some people 1.5 milligram is optimal dose. Some like I had a kid that had myasthenia gravis, and I think we were at 5 microgram, but the parents were scared, so they were going very, very slowly with 1 microgram, 2 microgram, 3 microgram, 4 microgram, 5 microgram. I always say that parents are right. I'm just a guide. So they went to 5 microgram and say, Dr. Kim, it's not cured, but she can open her eyes and she is doing much better. She's growing again, and we feel comfortable. We don't want to. This allows us to take a little bit of the Western medicine. We don't want to use the naltrexone too heavily dependent either. So I said, okay, then let's start the second agent, which was fish oil. So we used, and then we dosed it to the weight of the kid, and we did pretty well.
How do you go about sort of grayish presentation, not clear cut with the whole thing?
True. What I say is I always say LDN is my cornerstone.
Mhm.
LDN is cornerstone because LDN um, normalizes immune system. In the process, the immune system can wobble a little bit. And some people, the wobble is very uncomfortable. And I've seen yeast infections happen. They had great deal of difficulty. They feel like their autoimmune disease is getting worse, better, worse, better. So the person was trying to get me to agree that LDN makes autoimmune diseases go in cycle, and I just couldn't agree with it at the end. It's true. In a few people, they don't tolerate LDN. I just had that visit today with one of my patients, and she just cannot tolerate LDN. Oh, and she's too afraid to do 10 micrograms or even 100 picograms, which I understand. I have a feeling that even that 1 microgram may have to be down adjusted. The MCAS to me is not a diagnosis. It is a, if you think about it this way, it's a node. It is a very important common pathway to multiple. MCAS is a symptom, and you can enter MCAS from Lyme disease. You can enter it from post-viral illnesses like long COVID. You
Oh,
can enter it from autoimmune conditions. You can enter it from mold. So if you think about it that way, then MCAS is not just MCAS, but it is a sign and symptom of sick immune system. LDN tends to normalize immune system. But I think what I'm realizing is that there's, of course, more than just LDN for modulating immune system. So another tool that I do use is um, called ketotifen. And ketotifen is really wonderful because it is a H1 blocker. Basically, normalizes the mast cell function. So if you think about it, LDN is a brother or sister of two ketotifen, a sibling to ketotifen, and one takes care of microglia to return normal. The other one, mast cell, to get it normal. Now you got two big bad wolves that can create problems now. Taming methylene blue, the exact mechanism is hard to know. But what I see is that usually people who do really well with methylene blue push it towards pro-oxidant dose, not mitochondrial dose, not serotonin dose, beyond that. And then they stay on it for a little bit, and then the MCAS is greatly improved, or their chronic fatigue is greatly improved. So, and if you really think about it, at that dose, we're talking about antimicrobial. But it makes sense because one of the ways you can enter MCAS is hidden infections like Lyme can give you MCAS, but post-viral, chronic viral activation can give you MCAS. So I think that if you think about it, that methylene blue doesn't discriminate like antibiotic. It pretty much kills anything that doesn't belong in your body, and that is the strength of methylene blue. It's a pro-oxidant that, like IV vitamin C, you have to really, if you're going to go high doses, yes, you have to do G6PD testing.
Yeah, I just did the G6PD. My concern with ketotifen is the side effect profile, grogginess and tiredness during the day. So now it's gonna confound a bit. It's with fibromyalgia or chronic fatigue syndrome. Now you're adding ketotifen at bedtime, but the next day you're groggy and you're tired. So
well, then I tell patients if the bedtime is not good, you take it at dinner time.
try. But I did take exogenous ketones. They are amazing.
You know what? It works for you. It's continue doing it. Because I tried it, and when you say amazing, what did you get benefit?
Pain after 3 days, pain diminishing by 75%. Mental.
What are you taking?
It's the one that they did with NASA. So it's in Canada, K1, and it works in 45 minutes. It between 4 and 6 hours, gives you great energy, mental clarity, takes care of brain fog.
That's the drink, right?
You put it in.
It's so expensive.
Yeah, it is expensive. But I take half a pouch, so that's about $4 US per day. But if you've been struggling with those symptoms for years or months, and it gives you a
listen. So the question that I have is, why does it have to be that way?
Because
beta hydroxybutyrate. So it's very interesting because they have inner bark of tomentosa. That's very interesting. It's not cheap to be sick. Do you agree?
It's super expensive.
Yeah. I want you to do me a favor, and can I share screen?
Sure.
Because you see beta hydroxy, beta methylbutyrate, it's the same. And then I want you to consider getting something that's cheaper. Same thing here.
Thank you. And the thing
is science. And then I love doing this because sometimes I learn like cool things from
that's
members.
The regular one, and the K1 is the jet fuel from the same company. That's the NASA.
Well, I have had people who say that exogenous ketone is helpful. I just haven't found it.
So my LDN makes me crash in the afternoon, so I take the K1 at noon to try to help with the LDN side effects. I went from 0.1, so that's my dose for now. So maybe
BHB plus. Do you drink the caffeinated or caffeine free?
I have the caffeine one for now.
No studies. Do me a favor, see what happens if you take the other one, and then take it with caffeine.
I have the other one. I tried it yesterday, but I'm just in the beginning, right? So they say like immediate effect for some symptoms is right away, but full benefit just like LDN.
Yeah, but thank you for teaching me something. If you're like using ketones to treat condition, anxiety, then I think exogenous ketones, there's a place for it. If you're trying to use ketones for suppressing seizure, then exogenous ketones may make sense. For people who lose weight, if that helps with the hunger, then if it's exogenous ketone, D-ribose plus creatinine plus ketone will be my answer.
Okay.
Yeah.
Next time, the GLP-1 at microdose and what you think about that for fibro.
Sure. I'll come back and
My question today is if I have a method to improve or increase deep sleep,